So I would cycle.
Okay, so let's start from where. What level are you going to treat?
Pretty tight. I still have to count.
Kind of tight. Because I know what it's supposed to feel like. That's okay. Just relax. Just do what you feel.
3.
Okay, put that right there. It's the PIP joint on that place you want to treat.
Sore on that side?
Okay.
It's a little bit more sore on the right side, actually.
And I want you, first of all, let's back up a second.
Okay.
Go ahead and sit down. Okay, what I want you to do first is I just want you to feel my hand. Okay, is it tense? Is my hand tense?
A little bit.
Okay, does my hand feel like it's like nervous, worried, hurting? Okay. Now, see how much information you can get just from the light touch. That's the kind of palpation skill I want you to use with this. Right now, what I see you doing, I see you a little nervous with this. And so I want you to think about relax my hands. Because once you relax, your hands are going to go where they need to go. Right now, it's like, this is how your hands are acting. But do you see the difference in the way my hands feel to you? And what you make your hands feel like. Okay.
I think I just lack a lot of confidence.
It's okay.
I still have to start at the top and like count.
That's okay. I'd much rather you did that so you know what you're doing than to pretend that you have something that you don't. But at the same time, I want you to feel comfortable that you're not going to hurt anybody. If you do it like I tell you, you will never hurt anyone.
Okay.
So now you know where you're going to treat. I want you to put the PIP joint of that index finger on the transverse process. There you go. Okay, now relax your hand. See how it just naturally goes to here when your hands are relaxed? So it's right where it needs to be. See how? Okay, now so now what I want you to do is take this hand, bring it up here on his head, and hold on to this part of his skull. Do you see how you've got his head in your hands? So you got it, right? So now I want you to use this as a fulcrum, push up. There you go. Do you feel how you can get him locked in just extension? Do you feel locked?
Like it is?
Yes.
Okay.
Yeah.
It's way easier than
Yeah.
I've been doing.
See? So now you're locked. Now here's your side bending. You're there. Okay, that's all the side bending. So
The
everything
actual force
is
is
rotation only. I'm gonna come under here, and what you're gonna do is your rotation is your force.
Whatever, I don't
Just
know
like
what you're doing.
that. Feel how it's going both together like this. My hand here is moving. My hand here is moving. All of it's going together. And we're not locked right then, so that's why we didn't get a click. But so if you go back to doing this, let's go back to normal, back to where we were. So you're going to go extension here, and then you're going to go side bending, and your rotation.
That feels
Yep.
like it is to
Mm-hmm.
Okay.
Yeah. So now back to normal. So what you don't want to do
Sorry,
is
my
go.
hands are kind of sweaty.
What you don't want to do is go. Okay, side extension, side bending, rotation. Are you there? Okay, I'm gonna try, and then by then they're gonna guard, and you're never gonna get anywhere. So you kind of got to do this with fluid motion, and try and do it as quickly as you can. Now, there's a couple of distraction techniques that work really well. One of them is to have them move another body part. It's not involved, like raise your leg, or something like that. It distracts them, but don't ask them to do it unless you're ready to thrust. Because when they do it, you wait till you'll feel the muscles go relax, and then that's when you thrust. You go quick, and your thrust is short and fast. Okay. And then but the longer you hold them in locked position, the quicker it's going to be till you come out. And you get no pulse.
And do you always then switch, or do you do a few, like if you're just feeling it and you just stay on that same side?
You sure can.
Sometimes you switch.
I switch.
Like, is that
that's
balanced?
why the reason I do that is that I'm diagnosing as I go.
Okay.
Okay. So I diagnose. It's like, okay, I found one here, and then I'm going to check the next place and see how that goes. Well, there's another one that way. And so I'm diagnosing and treating as I go. And that's one of the reasons you have to get comfortable with doing both sides. Okay, I mean, using your right hand to do the rotation at the chin, and your left hand to do the rotation at the chin.
And they're both this direction.
Right, correct. Both of them, both of your hands are working in concert in a rotation, but you've got to hold the other locked maneuvers.
I'm not fighting. I just want to see what it feels like.
Sure. Yeah. You want to.
So I think it's just so